Welcome to The Bridge, Your Health, Your Voice, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
Today on The Bridge, we are highlighting a changemaker who is building connections between research, healthcare systems, and the community. Dr. Hillary Edwards, Director of Research at the Patients Program. Dr. Edwards has played a pivotal role in shaping how research is conducted with patients, not just about them. Dr. Edwards has led groundbreaking efforts to elevate patients' voices in every stage of the research process, transforming how institutions engage with communities across the country. Hillary standout accomplishments in the creation of the Patients Professors Academy, which is an innovative initiative that equips patients, caregivers, community leaders, clinical researchers, healthcare professionals, government, policymakers, pharmaceutical companies, and others. The PPA highlights the expertise of our partners in co-developing research to make it more relevant and patient-centered nationwide. Hillary's work hasn't gone unnoticed. Dr. Edwards was recognized once again with the prestigious ASTARISQ Award, recognizing commitment to advancing science through accountable and equitable stakeholder engagement. We're thrilled to have Dr. Edwards on the show today. Ladies and gentlemen, Dr. Hillary Edwards.
Thank you, Rodney. I should have you write my bio every time I have to be introduced because, wow, thanks for making me feel so good.
Well, Hillary, you know what? This is something new. Again, haven't been on the show in a while, so we've kind of had a couple tweaks here and there, and I think the intros is giving folks their flowers, so to speak, but also giving an opportunity to, again, shine a light on some of the things that are being done in the community. So it's it's well deserved, I should say.
Thank you. Well, yeah, I don't know if I've been on since I got my PhD. So again, happy to be here. And as you know, while I appreciate Dr. Edwards, as my patient partners know, you can just call me Hillary too.
Okay, well, we're going to go with that. Hillary, we're going to dive right in.
Sure.
With ASTARISQ Award being renew under the current administration, the current climate, when we're talking about how to say things now, how to phrase things now, a lot of buzzwords that you cannot say. How has that influenced your vision for your project with ASTARISQ?
What a great question, Rodney. A few months ago, I actually spoke to the University of Maryland Baltimore Foundation with our patient partner, Dewan Patterson. And one of the things that he mentioned was how to be responsive without being reactive, because our work has to continue, right? Healthcare in America needs to be trustworthy. We need to have quality care. We need to have patient safety. All of these things are still true. And while we may not be using language that some people find to be triggering, it doesn't mean that the core values of having affordable and accessible healthcare for all Americans and people who live in America, isn't a priority. So as we think about this summer roundtable series for 2025, I've really spoken with healthcare systems across the United States, our previous panelists from the past 2 or 3 years of our ASTARISQ Summer Roundtable Series programming to find out what's important to them. So while we have some really great topics from prior years around, I think last year we talked about tools and resources specifically for implementing health equity. This year we're really focused on trust and trustworthiness in healthcare and science. So what does a credible messenger need to do in order to ensure there's health literacy in the populations that they serve, work, and play in? We talk about improving patient safety and improving healthcare delivery. And a lot of that has to do, again, with health literacy and communication. Who are the credible and trusted resources as people are trying to navigate the best care for themselves? So I think, you in the introduction, you talked about patient-centeredness. And patient-centeredness doesn't change because the language is changing. It just means we have to continue to listen to hear what the priorities are and respond to those priorities while still ensuring that we can provide as best as we can the information that helps people make the right decisions for themselves. And hopefully that means that they also improve their health outcomes in the way that is backed by science.
When you talk about having conversations with DeJuan Patterson, who is a trusted messenger of the community and a valued partner here at the Patients Program, we mentioned patient-centered to him. I'll never forget that in the very beginning of him introducing himself to the Patients Program, and it took him a while to kind of understand what we meant by that. So when we talk about patient-centered research, especially in communities that have been historically marginalized, how do you make sure that their voices aren't just heard, but they shape the direction of your work?
There are two main messages that I think about that have really driven the work that I do here at the Patients Program. It's driven my career before the Patients Program. It drives the work that I do when I volunteer out in the community. And the first is nothing about us without us, which is what I learned, I think, in my first year of my Master's of Public Health program. Gosh, over a decade ago. How time flies, Rodney. Nothing about us without us means, right? Like, I can't say what's important to you if I'm not including you in the conversation. And so since I've begun working in patient-centered research, we always make sure to have those voices of those whose work we want to change involved in the conversation. So nothing about us without us, forever and always. The other thing, and I like to think that this is also how I lead my team, how I lead research projects. It's about making space and stepping back. So I know that I have a keen vision for logistics, right? You and I have worked on Patients Day together. We've worked on different projects together. I love building scaffolds for other people to be able to climb up and rise or elevate the work that they're doing. And so I think that part of how I lead, especially in building out our Summer Roundtable series, is I listen to the people who I want at the table for what's important to them now. And I can provide the questions or the prompts to help us come up with what that conversation will look like. Again, each of our Summer Roundtable series webinars is a roundtable. It's 4 people discussing a topic, and they all have equal voices at the table. When we prepare for each Summer Roundtable program, we come up with the themes, which, similar to how you and I prepare for the podcast, you give me some questions that I can think about, and then we are, in conversation. I do the same thing for our Summer Roundtable series. And then it's giving that space, it's setting up the Zoom, it's doing the promotion, it's getting the registration done, it's getting the evaluation, but it's creating that space so that people who are doing this work can talk to each other. Because I think more and more, and you mentioned in this changing climate, having people talk to each other about what's working and what's not and what solutions they're coming up with gives other people new tools and resources to maybe think creatively about how they can solve those problems too, right? There's no one size fits all. We talk about this with community engagement. We talk about this with patient engagement. We talk about this in partnership with collaborators across the United States. There's no one size fits all. And so having more models, having more resources, having more conversation, having all of these tools helps us really navigate this time of uncertainty. And what might work now might not work again in 6 months, but the fact that we're having these conversations hopefully gives others hope. It gives other people a language that allows us to navigate and to, again, show up for the people who we partner with and collaborate with and that we serve, to continue to provide trustworthiness, again, in healthcare and in science, and improve patient safety, quality, access, and affordability for all Americans and people who live in America.
When you said something that kind of gave me a pause or had me, kind of look up in the air and think a little bit about, 'cause I'm a very visual person, and you talked about you providing a scaffold, or you like to build scaffolds and kind of let people climb or let people navigate that space. And when I think about a breakout session at PPA, the roundtables, that is a space where folk can have these conversations. And a lot of these conversations are rooted in health literacy. And as we know, health literacy is a game changer. What have you found to be the most powerful ways ASTARISQ is helping patients not only understand their care, but feel comfortable navigating?
One of the things for both the Summer Roundtable Series and the Patients Professors Academy is that participants are coming in with their own experiences in whether it's navigating the healthcare system, how they understand the health services that they receive or the health research that they read about. And so when I think about health literacy and the space that, speaking specifically about the Summer Roundtable Series, I actually think most people are coming in with a knowledge of what works for them for what they need in order to make decisions. To use words like the structural assumptions that we make that people who have poor health have poor literacy is incorrect. I think that we have to recognize that people are given information that may be based in science and based in evidence, or not based in science and not based in evidence. And how they understand that information is not based on their own health literacy. I think it's about the structures that they trust to receive information from.
Yeah.
So I say that as in my hope is for this year's Summer Roundtable Series, we're able to get conversations going about what makes information trustworthy. And if we can identify some ways that either people say that this is the reason that I trust this information, this is the reason that I trust this organization or this guidance, right? Whether it's from the federal government or from their primary care provider, we get to learn what people value when it comes to health literacy, so that whether it's for the next 2 weeks, 2 months, 2 years, 2 decades, we, the Patients Program, and those who attend the Summer Roundtable Series or Patients Professors Academy have better ideas of how do we get our message out in a way that is trustworthy, so that the health information that we're providing, that for me is based in science, based in evidence, and trusted, that people feel good about the decisions that they're making based on the information they have. And so I'm hopeful that specifically for health literacy, we are able to create an infrastructure, again, where people see health literacy as something that the health system, something that researchers, something that policymakers are responsible for doing well and being stewards of health literacy, and not placing the burden on those who are receiving information. And we're talking about if they are health literate or not. Does that make sense?
It does make sense, and it kind of reminds me of an analogy that I've used before. Folks who are listening maybe have heard it before. As a coach and coaching young kids, and I'm trying to deliver a message or deliver a play, and I have multiple different type of players on my team. I could say one thing to one player, a player A, and he or she gets it. I could say the same thing to player 2, and I may have to say it to him, but then also, you know what, show it to him on the clipboard or let him know exactly what I'm trying to get to, what play I'm trying to get to. I may have to tell player 1 that, say player 2 that, and then also tell player 3, tell it to him, show him on the clipboard, but then also take them out on the court, take them out on the field and kind of show it to them so they understand it. At the end of the day, as a leader, as a coach, as someone who's provided that scaffold, provided that space for us to learn and grow, you have to figure out a way where everyone understands and how they understand it and deliver it to them that way. And I will say this, Dr. Edwards, out and about in the community, when folks talk about the PPA and their participation, they didn't know what they were getting themselves into, but by week 3, by week 4, they were excited about what was going on. So the team, you and your team are doing a fantastic job of providing that space, providing those space where folks can kind of learn and understand, for one, how people understand information and how to deliver it to them so it makes sense for them now and beyond. Which leads me to my next question. When we're talking about balancing science and excellence with cultural relevance, isn't always easy, right? You just talked about it. People learn and understand things differently. How do you ensure your research stays grounded in both?
I think it's having great collaborators.
Yeah.
I
Sometimes
think
it's as simple as that sometimes.
Yeah, I don't know if I have a more profound response than it's having great people to work with. I think sometimes, again, in the research space or in academia, we overthink things a lot. And sometimes for me, it's just popping over to your office or popping over to Eric's office and saying, like, here's the here's a very long sentence. Like, can you what did I just say to you? Right. And by whatever you say, I'm like, cool, that is way better than what I was thinking. And so it doesn't have to be more complicated than that. Right. If we're sharing a message that we both care about, we're going to come up with a better solution. And it's not like your version is better than mine. It's that we're better together.
Yeah. Yeah. And I think using that same example, leaving space for whomever you're talking to kind of give their opinion back or give their thought process back is part of the process as well, right? Because again, it doesn't have to be perfect. It just have to make sure you understand it and we're on the same page so we can kind of get started on this journey, because it is a journey. What I'm realizing is it is a journey. Folks who have signed up and participated with the PPA, ASTARISQ the Roundtable Series, have not only been with us for one project, for 1 year or for one, they've gone along with us along this journey, and we're learning and developing as we go along. And one of the things we talk about or harp about a lot at the Patients Program is community partnerships. Can you share a story or an example of how building trust with local communities has impacted the success or the design of your work?
So, Rodney, you mentioned community partnerships, and I'm in a unique position within our Going National initiative where one of the priority communities that we're looking to build relationships with is health systems. And that could include federally qualified health centers. It could include hospitals themselves, community clinics. And I'm really excited to be learning from health systems. Again, these are the front-facing, the patient-serving organizations who really could benefit from being part of the Roundtable Series. And so when I think of who are some people who have shown an interest in patient safety, patient quality, health outcomes, I think of organizations like MedStar, who have been part of the Summer Roundtable Series. This will be their 3rd year.
Okay.
And I think, well, you might say, well, Hillary, a health system is not a community partner. I actually think it might be in this instance. One, it's what our national participants have said is important to identify as a potential collaborator.
True.
But I also think, when we think of barriers to health literacy or to care, systems play a big role in that. And so if we're able to highlight systems that are prioritizing triage systems where if someone comes in and there's a language barrier that they're figuring out, how do we make sure this person gets safe care while being HIPAA compliant, so making sure that their privacy and their confidentiality is secure in a way that maybe in this moment feels threatening because of the federal climate. I want to know how they're changing their systems so that other health systems can learn how to provide better care and safer care for individuals who are seeking services and therefore have better health, right? Despite what's happening. Yeah. So I've been speaking not only with health systems that have already been involved in the Summer Roundtable Series, but also looking to other health systems that have demonstrated an interest in the Patients Professors Academy and reaching out to them to figure out how can we pull you into this conversation, one, for this year's programming, and how do we look for the next opportunities? Are there ways that, for example, when the Patient-Centered Outcomes Research Institute comes out with its Eugene Washington Engagement Awards this coming year, is there a way that health systems could really go after capacity building together, because we can learn how to be patient-centered better when we don't have the language that we used to be able to rely on to say that we're doing the work. And I have said this, DeJuan Patterson and I talked about this, is that when you take away language, that doesn't mean that the actions also get taken away. So I think it's figuring out with your collaborators, how do we communicate the work that we continue to do in a way that can be understood by others?
Yeah.
Because to your point, when we started the patients program 13 years ago, DEI wasn't a thing. Sadly, right? But to the point of we can forget that we did this work before some of this language existed.
Yes.
And we built trust and trustworthiness. We can still do that. And I want to make sure that the organizations that are continuing to do this work front and center get highlighted, because I fear that because that language is gone, people might think the work is gone too.
Oh, wow. That is, yes, because the language is gone, the work is gone. Wow.
And I think I will say, as I was saying that, I was like, but wait a minute, if you have credible messengers and if you've built trust and trustworthiness in these partnerships, then your partners know that you're not going away. But again, the broader media, the broader public might think that all of these things are getting shut down. And that's, how, again, we need to focus on how are we building trust and trustworthiness in healthcare and science, and who are the people that, as maybe some of the natural channels for this information that were trusted are going away, what is replacing those channels? Yeah. Who is replacing those channels? And how are we receiving information that is vetted by people that we trust to give us information so that I and my loved ones stay safe and healthy?
Yes, that was a great way of explaining that and working your way through that, because during this process where words are going away, one might think that attention or systems are going away. But I was in a meeting with Dr. Mullins a while ago during all this changing, shifting of systems and things, and he mentioned about our North Star back 13 years ago has always been togetherness for everyone, has always been willingness to help and listen for everyone, willingness to help and change for everyone. And I think the patients program has, during this time, hunkered down on that. What we say in terminology now, we're standing 10 toes down and providing opportunities for everyone, for all to have a seat at the table, so to speak. And I know that is something that the patients program is proud about, and we're going to stand in that. And I know ASTARISQ is playing a huge role in that as well. But talking about looking ahead, talking about down the road, talking about this journey that we're taking with our patients, our stakeholders, our trusted messengers, folks in government, right? What kind of long-term impact do you hope ASTARISQ will have, not just in the research circles, but in everyday care settings for people who often feel left out in that healthcare conversation?
Similar to what you just said, Rodney, I hope that people can look to us as a resource that isn't going away.
Yes.
And isn't changing our vision or mission because the funding is changing. I also hope that by continuing to bring groups together, that not only fosters new collaborations, again, whether it's across patient advocacy organizations, community-based organizations, health systems, federal agencies, but I fear that if we stop talking, then progress will not be made. And if we're able to continue talking through these transitions, then when we get to the other side, we will be in a better place to continue to improve care and know where places have been hit the hardest. I think a lot about the work that we did during COVID. We had to stop doing research, but we didn't stop showing up for our communities.
Correct.
And so then when we got to, the post-ish pandemic now, right, we were able to re-engage community partners, whether it was around COVID or something else, because we didn't go away. Well, it's very easy to feel worried and scared and fear what's coming next. I hope that by us standing firm and tall and continuing to do this programming, that it brings people together who are willing to share their stories of how they're pivoting in real time now. I recognize that there are a lot of people who are scared and fear loss of funding, fear being targeted by organizations and people who do not share the same values of creating healthcare for all. And I want to make sure that we provide the resources that they passively can also take back to their organizations to continue to organize and be able to continue to provide care. Not everyone is going to be me, right? Where I will still be visible, and that's okay. We all have to do what we have to do in order to continue to move through this period. So that's my hope for the future, is that while I'm able to, fortunately, continue to provide these resources, I hope others are able to take these resources in whatever capacity they can to navigate this time and come out the other side having maintained relationships with the communities that they serve, maintained credible messengers and trust and trustworthiness in the information that they provide to improve healthcare and health services and health research for the communities, again, that they serve, and that we're able to improve health literacy, again, by ensuring that the organizations that are supposed to communicate that information continue to communicate the information that they can that is based in evidence and science.
Dr. Edwards, that was fantastic. You mentioned in 2020 or during the pandemic, we had to pivot. We sure did have to pivot. We're in a pivoting space right now. I think we have earned the trust of our community members. We've earned the trust of our trusted messengers that they can hold on as well, too, as, the waves get a little rocky. But again, our North Star is providing spaces and making sure health literacy still is important, and giving folks that space to share their concerns. So for folks who are listening or folks who are watching this and want to learn just what we're talking about, or they want to be a part of that space, they want to climb that scaffold, tell us where and how folks can hear more about what ASTARISQ is all about this summer.
People can go to our website at patients.umaryland.edu, and when they look on the left-hand side, they will see a Summer Roundtable Series page. They can go to that to learn about the 5 sessions we'll be offering this summer. They happen every Wednesday between July 16th and August 13th. So Wednesdays from 1 to 2 p.m. Eastern. And we're going to have a really incredible group of individuals, again, who represent lived experience, health systems, policymakers, nonprofit organizations, focused again on accessibility and affordability, health literacy, improving patient safety, healthcare delivery, and trust and trustworthiness. And I hope that our listeners are able to join us for one or all of those sessions this summer.
Yes, you heard it right here, ladies and gentlemen. Dr. Edwards, thank you for your time. We appreciate it, and I will see you another time.
See you soon, Rodney. Thanks again for having me.
Thank you for listening to The Bridge, your health, your voice. To learn more about the Patients Program, visit our website at www.patients.umaryland.edu.